Hello. Today, we're talking about COVID-19 and using GIS to close equity gaps for the Navajo Nation. My name is Este, Geraghty, and I'm the Chief Medical Officer at Esri. I'm joined today by my colleague, Ann Taylor, who specializes in providing GIS solutions to tribes. And I have two very special guests that I'm really excited to talk to. Delores Becenti, Navajo Epidemiology Center Senior Programs and Projects Specialists, and Wynette Arviso, Navajo Nation GIS Specialists. Thank you both for joining us today. You know, there is no question that we're all impacted by COVID-19. It has been hugely disruptive to our lives. Many of us have grieved for our loved ones, who suffered economic impacts, or been sick with infection ourselves. The reach of this pandemic is near universal, but it's not equal. COVID-19 has had disproportionate impacts on tribes, and today we want to explore the untold story of the challenges faced by Indigenous groups and the GIS solutions and innovations being applied. Anne, I'd like to start with you since you work with tribes all the time. Can you take just a few minutes to set the stage and describe why the impact of COVID-19 is different for tribes?
Sure, thank you, Este. Yes, COVID-19 has definitely, a recent study by the CDC suggests that American Indians and Alaska Natives are 3.5 times more likely to contract COVID-19 than non-Hispanic white folk.
And it looks like we're having a little bit of problem with your audio and video. You're frozen on screen. But even just that initial statistic is telling. And I think maybe we'll hope that your connection resumes shortly. But I do want to move on and see if we can find out from Delores. As a specialist at the Navajo Epidemiology Center, I know that you're really involved from this macro perspective. So how would you describe the impact of COVID-19 on Navajo Nation?
I think the impact was very great and very severe. From the very beginning, we did see the cases rise quickly and then also dramatically for the very few months that it began. And then also we've seen the impact in the mortality of the disease. And I think it was, you know, it happened all very fast, and at the same time, it just seemed like there, you know, anything that we could do was not making an impact. And I think that was the frustration felt at the leadership level, and then also at our level, trying to understand how to mitigate with what we had, with the resources that we had. And I think some of those issues really came to light when we realized that we needed more, and there was more to be done on the ground than we did in the very beginning. So I think that frustration and that level of being inadequate at the government level to be able to do things created a huge impact. And also just to see and to experience the level of impact firsthand was a great big it was pretty rough in the beginning, and I think that's what everybody felt here at the Navajo Epidemiology Center and also at the Health Command. And a lot of people that came together really did a lot, and I think just bringing everybody together and trying to make do with what we had was very important. So yes, I think the impact was very, very severe. And right now I think we're in the stage where we're trying to learn from the lessons, and we're trying to understand what it means to deal with a virus that's contagious and really makes an impact on the people that we're serving. So I think the impact just it left me reeling, and I think that's one of the biggest things that I've dealt with personally in terms of what can I help, what can I do, and I think those are the issues and the concerns that were on everybody's mind at the personal level. So I think as a program, we really did come up and we really did try our best. And I want to applaud the leadership because I think they really listened and they really understood what we had to say and the messages that we were giving them, and not only with what we had, but also the recommendations of how CDC or even IHS, the Indian Health Service here, that is a big partner in our health, really understood what we could do, and I think that was important, and also to understand that there was a level of knowledge and information that the president could understand and to learn from the people that knew about, the mitigation of the disease spread and burden and incidents. So I think all of that coming together really led to where we are at now, where we're averaging about 25 average daily cases. So I think we're there, and we're just gonna begin to ramp up what we're doing at the government level and support the leadership and support the people and what we're doing.
You said so many things, Delores, that really struck me. One that I think so many will relate to is that the early days of this crisis really left you reeling. And you also said that people were wondering what to do, but then you also mentioned that people got together and took action. So I wonder if you could speak for a second about how you used GIS and maps to respond to the crisis, to actually take those actions, getting you where you are today and be able to keep people informed.
So I think one of the awesome aspects of maps is actually showing visually what's going on, especially when you're looking at rural areas such as the Navajo Nation. Many people don't understand a lot of these places are like large swaths of rural areas. And you can drive out here now and drive for miles without an internet or signal or a cell phone signal. So I think in terms of communicating the message of there's this many cases for this service area, and this is how they are experiencing the impacts of COVID-19, I think really drove the picture home for the whole Navajo Nation, because as you understand, we're probably about the size of West Virginia. And so looking at, a map to really demonstrate what was going on at the ground level, I think was very important for us to give that to not only the leadership, but to all of the teams that were involved in standing up the response. So I think that was a good message for us to begin with, and something that I could do at my skills and abilities. So I think that was very, very important.
It sounds like it was. And so it seems like the result of your efforts in GIS was providing a much needed and broader awareness. Was there anything else that that came out of that effort that you think was valuable?
I think additional efforts were probably looking at how to get information between teams and how to communicate with the public. So a lot of the maps that we produce now, we do provide for the public, and they're able to see the burden of the disease and then also the spread of the disease. So we actually have 2 maps that we're sharing with the public right now. And it gives them a better understanding on what's going on throughout the whole Navajo Nation, not only for their own communities and for their own chapters. And I think that's important for them to make decisions and also to support the president in the measures that he's implementing, such as curfews and lockdowns. So I think those messages for just describing impact and trying to mitigate that impact, I think is important. We've also created a web app that looks at the testing locations for the Navajo Nation, because as you can understand, since there's really no way to communicate with the rural areas, I think it's important to give them as many means as necessary to get the information to them. And the testing locations was one of the ways that we could apply the ArcGIS Online and the web apps that we were able to create and bring that information to the public. So things like that, and then dashboards for the teams to really look at how their resources are being utilized and where to reallocate resources, I think was important for our logistics team here.
Yeah, really important questions and answers. And sometimes I always say the simplest thing in the world seems like connecting people with resources, but in practice, it's not always that simple. So it's great to hear that you can use the technology to facilitate those connections. Now, I'd like to turn to you for a moment, Wynette, and find out for you, how has COVID-19 impacted Navajo Nation from your perspective, working directly with the Yambito and Mexican Water chapters?
The COVID-19 has significantly impacted the Navajo Nation. On the Navajo Nation, we have 110 chapters, which are like states or counties within a state. So we have 110 separate local governments, and each one of them serve the people, the community members within their chapter area. And so with COVID-19 coming in, and as Delores indicated that, it came in quickly, and our president did a shutdown of all the chapters, which essentially shut down all the services to our community members. It left us really with nothing and not knowing what to do. So the impact was significant on the community members at the chapter level. People were without water. I mean, they relied on the chapter houses to get water, and in some cases, to make phone calls, because a lot of people don't have electricity or running water. And so a lot of community members end up catching it because they didn't realize, how it would spread. And even in those cases where some community members knew they had it and they said they were quarantining, they would end up at the chapter after the chapters were reopened for essential services for water. And they would show up and say, "I'm quarantining." And it's like, no, you don't, that's not the way to quarantine. You need to stay home. And so just trying to get the meaning and how to address COVID-19 was really, really difficult to do on such a short notice. I mean, trying to get the word out to the people, because the people don't have internet, and as I indicated, they don't have electricity. So how do we communicate with them? And I think that's where GIS came in really handy for a Yambito chapter here. And but overall, I think the impact has just been really great. And here at the chapter house, I know it's really changed the way things are handled, because we have a big meeting room and all the people come and they meet and they make decisions and they approve resolutions. That's how we operate at the chapter level. And all that was put on hold. And so they couldn't do that. And then, as I indicated, some people didn't have access to water. And so people were scrambling, trying to get water. How do we get water? You know, we're telling people to wash their hands and take care of themselves. How are they supposed to do that with no water, no electric? And so it's been really great. I don't know what word to use, because it's just been very significant, and it's been hard. And so as we deal with this, you know, we're trying to get communication out to our community members, trying to tell them, you know, these are the things you need to do, that this is what's happening, this is how we can handle it, this is how we can come together. And so it's really upended our entire way of life. I mean, how are we supposed to go forward? I mean, all our ceremonies have been put on hold. Our community gatherings, I mean, even like graduation, as the Navajo people, we come to celebrate graduations, because these graduates may be first generation students that go and get a degree. And so trying to come together and recognize that and give thanks, we couldn't do that. And usually the chapter house, the chapter houses are held for these community gatherings. All that had to be put on hold. And so people are trying to figure out, okay, well, how do we do these celebrations? And how do we run our meetings? How do we get people? How do we get water out there? How do we get food out there to the people that need it if they're going to stay home? You know, it's been quite an experience, I can say.
Sounds like it. You paint such a vivid picture, and I'm really grateful that you could articulate it so well, so that, you know, people around the world are suffering different kinds of impacts. But I'm guessing that there are many who are having impacts that, while maybe majorly inconvenient and hardships for them, are not the same as not having water, electricity, the ability to communicate with your loved ones, information from the internet. I mean, these are things that I think will really hit home with a lot of people as they try to imagine how, again, disproportionately COVID-19 is affecting different people around the world. So thank you for painting that picture. You did mention for a moment that GIS has helped to support the work. Can you dive into a little more details on what kinds of things that you've been working on with maps and applications to support and inform the community?
Yes, I serve on the Community Land Use Planning Committee here at Yavapai Chapter. And I also take care of my elderly parents. My father is a World War II veteran, 97 years old, and my mother's not too far behind. And so because of that, we really adhere to the CDC guidelines as far as not allowing visitors. We wouldn't even let family come and visit my parents. And and so I was at home and thinking, okay, well, how can I help? What can I do? And I have internet there, and I have my laptop. And so I thought, well, maybe I can help. And then I've been receiving the emails, and I got that package about the information about Esri's service that they were offering for COVID-19, the COVID-19 resources. So I went to that and I thought, wow, you know, I could use this. And so I started pulling some of the data for Ayambato, since I had that data. And I started building some some maps and some apps, and I was working with Anne and some other technical people trying to figure out, okay, how's the best way we can build this dashboard, because this is what we want to do. And what was happening was there were donations coming into the chapter, and these donations, okay, well, we could do radio announcement and then have people line up and get all these donations. But how do we know it's reaching the people that really need it? And that was one of our questions. And so I thought, well, let me do a map and let's keep track of the people that get these donations, so that way we can see who has received the items and who hasn't. And so we were able to do that. We were able to map all the people that lined up. We initially asked for their address, where they lived. And so the way we were doing this was we had a drive-by at the chapter house, and the people there were two people. One was handing out the donations, putting it in back of the vehicles. And then the other person was she was sitting in her vehicle, and she was communicating with people as they drive up and asking them for their address. And then she had her cell phone on. So I was at home listening to her on the cell phone, taking that information and entering it onto the computer. So we were mapping where all these people were that were getting these donations. And so when it was all done, the chapter leadership, which consists of a president, vice president, and a chapter secretary and a land board, they had a meeting and said, okay, well, how did it go? And I was able to pull out that map to say, okay, look, you guys, these are the people that were served, but there were pockets of areas that were blank, and we knew people lived in those areas. So among the people that were on that conference call while we were doing a Zoom meeting, and so they could see the map, and then they were saying, well, I know those people, I have their phone number. And then, so that's how we were able to reach those people. And so the following day they came in and they got their donation box. And then after that, we were able to look at the map again and see there were still a few homes that we missed. And we're like, who are these people? So the chapter vice president went to go visit these people, and come to find out they were elders with no transportation, no phone. And so So he made that delivery, and sorry, I just get.
It's an amazing story. I mean, I'm hearing such an effective use of mapping data, finding gaps, and then taking immediate action to fill those gaps. And you can say that in technical terms, it doesn't sound like much, but you're showing the human side of that there was deliberate outreach to people who really needed it and wouldn't have gotten it otherwise.
That is so true. And those people, they were so thankful.
I can only imagine. Well, I don't even need to ask you about the impact. That's very clear, that this changed lives and helped people through what is probably one of the worst times of their lives for many of us, I think. Mm-hmm. So I'm going to turn to Anne for a moment and give you a chance, Wynette, to recover. Anne, you're working with tribes all the time, as we said before, and I wonder if you can comment on some of the other things that you've been seeing from other Indigenous groups that are using GIS to respond to the pandemic.
Yeah, thanks. We've had quite a few tribes that are using our hub site technology and the program that Wynette mentioned, the disaster response program. They're standing up a hub site so they can communicate with their community on COVID-19 numbers or announcements that are coming out from their president or other officials at the tribe. There have been quite a few tribes that are using Survey 123 as an application to help map out where their elders are, and also, just like Wynette mentioned, what their needs are, and then they also use our software to then go out and deliver. They've got the addresses based on the phone calls and the survey responses. And then there are a few tribes that have come to us and asked about using ArcGIS indoors for helping folks come back to work and doing space management so that, you know, they're complying with CDC regulations while people can still come back into the office, you know, where to put sanitation stations, that sort of thing. So there's been a large amount of tribes, I think, you know, over probably 50 tribes that have used our disaster response program to get software at no cost and to, you know, build the applications and maps needed to help their communities.
That's amazing. And I'm always interested to hear the breadth of applications for different people in different places. So thank you for sharing that, Anne. I'm going to ask both of you ladies one more question. And this is really a question that looks to the future. So I'll start with you, Wynette. What do you think is next for GIS at Navajo Nation, both in terms of the pandemic and beyond?
Well, I'm hoping, my hope is that more chapters will be able to use GIS. And I had talked about Yavapai Chapter, but I also reached out to Mexican Water, and Mexican Water also used GIS, and in their case, they were able to identify people that had no water, and they were able to run water out to these homes. And then hopefully some of these homes will now get water line extensions. I know that there were some monies allocated to water line and electric, and as well as like cistern and solar systems. And GIS can be used to help identify those locations and help make decisions. And also, I know some monies were allocated to broadband. And with broadband extension, I'm hoping that these chapters will be able to use GIS in a lot of their planning and a lot of their decision making, just as Yamato has done here. And so that is my hope. I know Anne mentioned that that it was provided free for 6 months, and with that, both the Yamato and Mexican Water have been able to take advantage of that. In Mexican Water's case, they did stand up a hub and try to use as much of it as possible. But in their case, they're further out in the remote area of Utah and Arizona, the Utah and Arizona part of the Navajo Nation. And so it was harder for them because their internet service is really bad. They don't even have a landline to their chapter house. They have to rely on cell service. And so I'm hoping the technology gets expanded to all chapters, and then they're able to use GIS and even start with the simple dashboards as we have here at Yamato, and just use that. I know what our chapter is going to do. Our veterans group is talking about doing an assessment and determining what the needs are of all the veterans and where they live. And so we're working on that right now to help them develop an app so that they can go and collect that data. And because we were able to use this for the 6 months, we were able to purchase the ArcGIS online at the chapter, and it was approved with no questioning, because they could see the benefits of the software. And I'm hoping we'll be able to use it more and more. I know Mexican Water is talking about doing a community assessment and running around and getting all the information that they can. They tried to collect phone numbers so that they could just make phone calls, but it's been really difficult. So I think it'll be much easier if they're able to just have the app on their phone or their handheld unit and go around and collect the information, especially to those areas that they're making deliveries to for water and for food packages. And in Yamato's case, we were able to use what the data that we had to apply for some grants. And so we got some grants, and with those grants, we the chapter was able to purchase thermometers and some cleaning supplies like some wipes and disinfectant sprays and gloves and masks. And those packages are being put together, and delivery is going to be made, I think, at the end of this month to each household, now that the community members knows where these houses are and how many households are within the community. And they were able to get that grant. So I'm hoping that other chapters will be able to do that, where they can use GIS to help them with their funding needs, as well as with their local governmental decision making.
Well, that's fantastic. It looks like a bright future for GIS. And I also have maybe a surprise for you, and that is that we are going to be releasing a community health assessment solution that will be a free download to use with your ArcGIS Online next month. So maybe that will help with the veterans assessment and any other community health assessments that you may want to do. I didn't expect you were going to say that, so I'm glad that we'll have something that will support those efforts and make it even easier to launch. But let me turn to you, Delores, for a moment and find out from your perspective, what do you see as the future for GIS at Navajo Nation?
So in the foreseeable future, I think we're looking more at modeling and surge capacity for our facilities. So we are going to explore the CHIME model from Penn State and the CDC tools that we have for in ArcGIS Pro to use as a possible tool to look at surges and whether we have the capacity at the facilities to manage those surges. It'll also give us an idea of the NPIs that we're going to be implementing soon, because we are looking at reopening and we are interested in what's going to happen and how it will happen. So I think those tools will be very important in guiding us and giving us some scenarios in which we can get prepared for and really look at how to manage those surges. So that's, in the foreseeable future. And then also we're looking at additional dashboards to communicate with the public, and then also leadership and the health command on how to manage the resources and how to look at the information that's coming through from the local government, such as Wynette's chapters and things like that. Other initiatives that I'm looking at is looking at a suitability analysis for vaccine distribution, because I think right now we're not really understanding the elder population that Wynette spoke of. Is how are we going to get to them and where are they at, because we're so far removed in terms of understanding where those populations are, and the vulnerability of those populations is something that we're struggling to understand. And I think we can use GIS to further our analysis in that area. And then in the long term, I think this has really demonstrated what we can do with the technology here now, with dashboards and with information coming from the local and community areas of how we can use this to increase the capacity and the infrastructure of our public health system to respond. So it's not only COVID-19, but we have chronic diseases, and we also deal with some of the highest rates of motor vehicle crashes. So the disease incidence and the burdens is not just COVID-19. We also have other disparities that we need to look at. And I believe that GIS and public health will really serve a purpose of really identifying and analyzing and giving a picture to the people and to the government on how we can best tackle a lot of these issues that the Navajo Nation is dealing with. So I think that's going to be something that I'm really interested in. So I think, to sum it all up, I'm really looking at turning the challenges into opportunities and really looking at what we learned and how we can further our understanding and our ability to respond the next time.
Well, that's a great summary. I couldn't have said it better myself. We don't want to bypass this opportunity with all that we've learned so far. And I love how at your macro level, you have such a strong focus on the analytics that will inform what happens next. And Wynette has such a strong, more micro level perspective about the applied uses of GIS and how you can take action directly. You both are amazing women. I want to thank you, Delores, Wynette, and thank you, Anne, for spending this time and sharing your work. I'm so inspired by what you do, and I do truly wish you the best as you continue your efforts through the pandemic and with your grand plans beyond. Thank you again for sharing these impactful stories and information with us. And then I just want to say a thank you to our viewing audience for watching.